Gilbert, who's a specialist in emergency medicine and a senior consultant and professor emeritus at the University Hospital of North Norway, joining us also live from Oslo. Welcome to the News Hour, Doctor. What a week we've had. So many people, so many children dying of malnutrition. And those images that we're seeing are horrendous. Babies that look like skeletons right now. And you've been speaking to some of your colleagues in Gaza, not just about malnutrition, but then the connecting part, of course, the dangers of refeeding syndrome, when people that have been starved are then given food. Just help us understand how sensitive that is.
Yes, indeed, it is a very sensitive issue. And when you have starved a large population like this, where half of the population are children, you have actually emptied all the resources in the body to produce energy, meaning that the body has been consuming the fat, the proteins, and the other sources of energy. And when you are going to refeed that person who is already at the verge of dying from starvation, you need to do that in a very, very careful and well-planned and well-monitored way. This is an art of medicine itself. Mm-hmm. And the report from the Ministry of Health that came yesterday listed 260,000 children less than 5 years who are in need of nutrition. Now, when you start this refeeding of an exhausted, starving person, you need to balance not only the food stuff, but also to control the salt content of the body, what we call the electrolytes. And this needs monitoring equipment in the hospitals, and it needs hospitals. So everybody's talking about malnutrition and the starvation now, which is overwhelmingly important. But at the same time, the need of fuel into Gaza is paramount, because the hospitals cannot be operated without fuel. And the Israelis are strangulating the food supply. Now, the other point I want to underscore is that the head of the World Food Program, Carl Skau, yesterday or the day before yesterday said that there is enough food supplies at the borders of Gaza, enough to feed the whole population for 2 months. So when the Israelis now are going to make this theater of starting airdropping, why not just open the borders to Gaza and allow UN to enter with these massive supplies that are well constituted, that are scientifically composed, and that can be distributed through the hundreds of distribution points that the UN already have. We don't need any other theater of airdrop and the GHF and all this. That's only to satisfy the US and the mounting pressure on Israel. Open Gaza, let the professional people enter with the nutrition and make fuel available so the hospitals can refeed people in a controlled and safe way.
But, Doctor, it really is something that is so important, and we speak almost weekly, and that message to open those borders, to let those trucks in, to distribute properly, professionally what is needed. And as you were saying, that sensitive moment of refeeding a baby when they're close to starvation or starving is so important. How many more people need to die of starvation? How many more of these images? Because the UN is now saying 1/3 of Gazans are suffering from malnutrition. How many more weeks need to pass for Israel to do what you're calling for?
Well, this is an engineered, man-made starvation, a hunger disaster that is made by Israel on purpose. It's part of the ethnic cleansing. It's part of the genocide. So this question you ask rightly should be addressed to the governments of Europe, to the US government, to Canada and Australia. They have the tools to pressure Israel through boycott, sanctions and stop in weapon export, to stop the siege of Gaza and to allow the fundamental human right of food and water into Gaza. You know, humanitarian aid is non-negotiable. It's only Israel who is allowed to negotiate and to make all these massive,
And
sadistic steps to starve the people.
but
So I
when you
cannot
hear
answer
Israel
your answer.
saying, when you hear Israel saying that there is no starvation in Gaza, what goes through your mind?
That they are flagrant liars. They keep lying all the time. They just said there was no hunger. Now they are going to allow people to drop food by air. Why should they do that if there is no hunger? It's a flagrant lie. All the documentation, I can show you the data sheets from the Ministry of Health, from OCHA, from the UN, the last important humanitarian situation update from OCHA. They all show a massive malnutrition crisis for everyone in Gaza. And listen, there are actually 470,000 people who are now in what is called the IPC phase 5, which is defined as catastrophic malnutrition or hunger. 500,000 people, and the majority of these are children and women. There are pregnant women in the 6th month of their pregnancy who are weighing less than 40 kilos. There are currently documented 100,000 pregnant women and nursing mothers needing immediate nutritional support to take care of their pregnancy and their newborns. There is no milk power available. This is a Holocaust. This is an engineered hunger disaster aimed at killing the Palestinian people. And the West has the key to stop this by forcing Israel. I don't care what Israel is saying, because they are lying all the time. That is shown through history and through all the reports. So when you see the images of these children that you are showing now, how can the world sit idle in 2025 and allow this to happen? I'm a doctor. I've been working with Palestinians for 40 years. They are diligent, decent, hardworking, professional people. They deserve exactly the same right to food, to water, and to medical care as we do. The incidence of watery diarrhea and bloody diarrhea is soaring in Gaza. The incidence of meningitis is soaring in Gaza. The numbers of flaccid paralysis, i.e. poliomyelitis, is growing in Gaza, all while the West is sitting idle by and watching, and the Arab states.
Dr. Mads, thank you very much indeed. We really appreciate your medical expertise and your time, everything that you shared with us today. Dr. Mads Gilbert, thank you so much once again.